to, because skin can start to break down quite quickly in those areas. Loss of bowel and bladder control is often very common. You want to make sure that that person is, again, you're maintaining their dignity and comfort. You want to do excellent peri-care and anal care. You want to, because the urine is much more concentrated towards end of life and can cause skin to break down much quicker. So you want to be very thorough in cleaning those areas, and possibly speak to the nurse about the patient's wishes or desires of possibly having a Foley catheter put in. Many patients at this point in time, when they reach this level, are quite agreeable to that, because they don't want, and family members, because they don't want any breakdown. You want to apply protective barrier creams as frequent as possible to, again, prevent any skin breakdown. You may notice breathing changes, irregular, shallow breathing, and this is oftentimes associated with temperature fluctuations in the body. It's a very normal response. You may notice them breathing very rapidly, and you may notice them having periods of what's called apnea, where they stop breathing for up to a minute at a time. That is very normal, and that can go on for quite some time. Again, the best thing you can do is just be there and reassure the family that this is normal, and you'll do everything you can to make sure that they're kept comfortable, and the way to keep them comfortable is by doing the oral care, and that because of the breathing changes, they do become very dry. Normally when they get to the very shallow breathing stages, they really are not able to take sips of water, and that's where you really want to work closely with the family and the RN case manager regarding what is appropriate to give and what is not appropriate to give. You want to elevate the head of the bed and keep them in a semi-sitting position. That does help for better lung expansion for the breathing that they are doing. They may request oxygen and are able to have that. Again, that's something that the nurse has to get an order for, and that's not a problem. But once oxygen is put on, that does cause more dryness. So again, you want to encourage the family when you're not there. Obviously, you won't be there 24 hours a day. The correct way of doing good oral care. One family, just to let you know, was giving them instruction because they were very fearful. They wanted to keep giving drinks of water, and I said, well, I asked what the person's favorite drink was, and it happened to be Coke. I said, we can use the toothets in Coca-Cola also. You can put those toothets in anything where it feels that the family may feel better that the patient is getting something that they like. And then just instruct them on how to get as much of that liquid out of the toothet as possible, because a natural response when you're swabbing someone's mouth who's semi-comatose or alert is that when you hit the roof of their mouth, they will bite down. So you don't want to pull on the toothet when they bite down on it. You just kind of want to let it sit there for a little bit, and then their mouth will naturally relax, and then remove it. And encourage the family to do that. We don't want anybody biting off the tips of toothets and have the possibility of choking. Visual and hearing changes. You may notice that the patient may have a blank stare on their face. Their eyes may begin to tear. They tend to not blink as much. Their eyes may stay open or closed, but tearing is a normal response. If tearing stops and the eyes do look dry, it is okay to use artificial tears or something of that nature, but again, check back with the nurse manager or case manager, and she will guide you in that area. Hearing, I can't tell you enough or express enough how much I've witnessed since I've been in this area, that hearing definitely to me has been proven to be the last thing to go. You want to treat that person with dignity, and if they appear to be sleeping, you make sure that you tell them everything that you are going to do for them. If you're going in to bathe them, you let them know what you're doing, what area you're bathing, that you're going to turn them or massage them, play music, and encourage family to talk with them also. It's not unusual to see family members sitting around and just staring at the person saying they don't want to wake them. It's the best time for them now to say whatever they want to say to that person and encourage them to look for responses. That patient may no longer be able to verbalize what they're feeling. They don't have the energy just because of how their body is shutting down to say what they want to say. So I always tell families to look at other cues, as look at the eyebrows. When they say something, I ask them to share something that's very personal that only they and that person would know, and watch for the eye to move or their lip to curl just a bit. You know, that's a response that that person is responding to them. They just can no longer verbalize it. And that is a great comfort to family members. And I have yet to have a time when I've asked someone to do that where there hasn't been some response. You want to regulate the environment in which the patient is in. Make sure it's appropriate. If the patient is running a temperature, you don't want to have them under a lot of blankets. A lot of families really want that, but if you just take a little time and explain to them that it's normal for their temperature to fluctuate, that if they feel too warm, it's okay to remove the blanket or open a window for a little bit or have a fan. TV and music, if that's something the person was always accustomed to, there's no reason to stop that at this time. Frequently at the hospice home, or just about a year ago, everybody was into Wheel of Fortune, and I remember at 6:30 running around the residence and putting Wheel of Fortune on everyone's TV, be it that they are awake or not. And I would always talk to the people walking in saying, you know, let's not buy a vowel today or something. Humor is great, and wherever you can put humor in, it's a great barrier breaker between yourself and the caregivers, as well as for the patient when they are able to respond. No one likes to be serious all the time, even the person who's sick. Signs that you'll know that death has occurred is that you will, again, notice that blank stare. Notice that the breathing will have stopped. If you can, take your hand and try to put the eyelids down, if possible. There will be no pulse. You'll, again, notice no breathing. You may notice a loss of bowel or bladder control. And the jaw, usually by this time, is hanging down because they have been mouth breathing for quite some time. You want to notify the nurse as soon as possible, or if you know that you just have that feeling that death is very imminent, and you can tell that by respirations that have slowed down to about 4. Make sure that the nurse is aware. The nurse will be the one to notify the physician, and she will come out to the home or wherever you're at. The nurse will be the one that will do the definite, look over the body and make sure that all vital signs have stopped. Again, you want to be there to comfort the family and encourage them, even though the patient is no longer alive. I still encourage them to say whatever they would like to say. Give a hug if they want to give a hug. And they will have a chance of viewing the body again. The nurse will take the patient's family and talk to them, and that's when your key role is to come in and prepare the body or do post-mortem care. What I really want to stress is that as being part of the team, that you find out as early as possible in your care of a case is to find out the person's religious background and cultural beliefs, because this does play a very important role in how you prepare the body in end-of-life care. Examples that I can give you are some cultures require that the body be washed with special oils or lotions first, or another culture may say that just the family can do post-mortem care. Again, that is something that we have to abide by because that is their beliefs and wishes. And other religions, I know that post-mortem care needs to be done within a certain time frame after the